where she received her bachelor's in nursing and a master's degree at Women's Health Nurse Practitioner. Lastly, she received her doctorate in nursing education from Case Western Reserve University. So with that, I would love to turn it over to our presenters today.
Thank you so much, Claire, and thank you, Dr. Bryant, for joining me today on this webinar entitled, Are You Ready for the Future of Healthcare Education? I want to emphasize the question and the words, are you ready? So readiness for what? What do we need to be prepared for? So when you think of the future of healthcare education, what one word comes to mind? Technology, interprofessional education, virtual learning, flexibility. If you Google search the future of healthcare education, you will get over how many hits? If you guessed 1 billion, you're absolutely correct. So how do we bring so much information into a 1 hour seminar or 1 hour webinar and make sense out of our role as educators and what we need to prepare ourselves for? So we're not trying to boil the ocean on this call. We are really focused on social mission. Next slide, please. So I want to begin by asking you a question. When you see this image, what comes to mind? Take a few seconds, look at the image, and then put into the chat box or the Q&A what comes to mind. And Kelly, do you want to speak through this as well?
I was going to see if we had any messages. And nothing yet. So we have a nice, small, intimate group. So we'd love to hear your thoughts on this image.
Typically, when people see this image, they say that it's unfair, that there is the assumption that's made is that there is a belief, a bias about the abilities of all of these creatures. Who can do what? So the gentleman is saying for a fair selection, everybody has to take the same exam. Superficially, if I only showed you those words, that sentence, you might think, all right, fair selection, everybody has to take the same exam. That's pretty much the standard, right? We give exams as educators, everyone has to take the same exam. But when I show you the differences of each animal on this slide, and I ask the question, please climb that tree, we start to think about the differences and the abilities of the monkey, the penguin, the elephant, and so on. So one of the, one response says assumptions are made, and someone said there's a difference between, that went really quickly. Kelly, did you capture that?
The chat is now open. So we have a message that says, I would say it's equity versus equality. And someone else said assumptions.
I love the fact that you said equity versus equality, because when we think about equity, it's meeting people at their level of need or recognizing the individualism that comes with everyone. And the equality is just seeing people as, well, if this person can do it, then you should be able to do it too. And if you can't, then the problem is yours and yours alone. So the inequity in this picture is very apparent. There's no way that the elephant is going to climb that tree. So for a fair selection, the elephant is discounted through no fault of the elephant. So it's not the individual animals that are, creating this inability. It's the ineffectiveness of the question. And how often as educators do we look at what our policies and processes are that could be inequitable and yielding inequity in the results based on our expectations, like this image. So for today's session, I want us to really think about that. I'm going to focus on the first half hour, and then Kelly is going to come in behind me and she's going to bring us home. But throughout the whole session, think about how inequity plays a role and what we can do about it. Because again, the future of healthcare, I said there's a billion hits. And if there's a billion hits, what exactly are we doing? Because we can see how our colleagues could feel very overwhelmed about the future of healthcare education. Okay, next slide, please.
All right. So what are we going to cover during this webinar? So as an educator, of course, we want to go over our objectives for this session. So we're going to discuss efforts to reconcile the complexities of health equity. We know that there's a lot of different aspects that go into us as educators, making sure we promote health equity for our future of healthcare providers. So we're going to discuss some of those. And then we're going to also explore the social mission as a catalyst to healthier communities. And again, as you can tell, this will be a very interactive, so we want to hear from you. It's not going to be just us lecturing. So when we think about health equity and the future of healthcare education hinges on educators who. So we're looking for you to complete this sentence. What is it going to take from us as educators to help create this generation of social justice advocates, of nurses that are going to go out there and help create a more equitable healthcare system, who are going to advocate for their patients when they see bias and discrimination? What is it going to take from us? So again, I want you to go into the chat box and give us some examples of what, as educators, what do we need to do? And please, Kenya, feel free to add on if I'm missing.
Oh, no, it's great. And while everyone's completing the prompt, the future of healthcare education hinges on educators who, and you fill in the blank. While you're finishing that, Kelly, I know that we just talked about healthcare inequities.
Mm-hmm.
And when we think about inequity, when we think about that image, we should also emphasize the fact that our role is to meet individuals at their level of need, whether we're talking about patients, whether we're talking about students. And what are the ways that we meet individuals at their level of need? That has to be something that future healthcare providers are very cognizant of. And so I know there's some responses to your prompt.
Mm-hmm.
And one person said, the future of healthcare education hinges on educators who build equity, inclusion, and belonging content and practices into every step of pre-health, healthcare education, and professional education. I love that response, very inclusive. And someone else said, the future of healthcare education hinges on educators who are proactive, not reactive in situations. I love that as well.
Great statement.
Very nice.
Anyone else? Because if we look at our education, I know me, when I went through nursing school, it's so focused on caring for the individual's medical condition. We did not focus, at least for me when I was in school, all those other aspects that come into somebody's health. What are those social considerations, those social issues we need to address that affect someone's health? So those are the things that we need to make sure too, as educators, we're including. Any other comments before we move on?
That's all that I have.
That's it. Okay.
So health equity is the right for everyone to achieve their highest level of health. And it sounds so innocent, right? So who would argue with that? Everyone should have the right to achieve their highest level of health. So why do we have so much going on in this respect. We have the 1-2-3 for Equity as a national initiative. We have so many organizations emphasizing health equity. What gets in the way of health equity? And I think about the story of Lisa Gomez, a 5-year-old who moves into a new neighborhood with her mom. She has asthma, and every day she goes to school. And one week she's at her new school. She has an asthmatic attack. They sent her to the emergency room. And within 1 month, she is seen in the emergency room 5 times. And the 5th time that she enters the emergency room, she suffers such a prolonged period of anoxia that she's brain dead. And she subsequently dies. How was Lisa's right to achieve her highest level of health denied at such an incredible young age? How did that happen? And when I share this story, there's always someone across the country that recognizes this story and thinks it's about their institution. So although I'm talking about this young lady, young girl, who it happened in the northeastern part of the country, it resonates with others. So why is it that someone like Lisa would die so young? So when we ask that question and we have conversations, we can hear different beliefs. Some people think, I've heard, oh, the mother should be charged with neglect. The mother should have done something. And when I probe further, I'll hear, well, the mother might not have, removed things from the household that could have, contributed to Lisa getting sick and having the asthmatic attack. Or maybe the mother didn't give her medication right. Maybe she didn't have the medication. And usually the conversation centers on what the mother did or did not do. So when we talk about implicit bias, the beliefs and attitudes that we have to explore, how did these attitudes and beliefs come to be? What happens in the learning environment? What do I read as a student when I read about asthma and patient teaching? And I know as nurses, one discipline, the focus is on patient education. So I can hear and see how we can take that information and then jump to the conclusion that the mother might not have done something that she was supposed to. But sometimes our responses is based on our implicit bias, and we're not even thinking about it. Other times I'll have people who will say, well, what about the social determinants of health? What about the political determinants of health? Where does she live? And then when I share with them, well, Lisa lived in an area of the Bronx in New York where the air quality is the absolute worst. We call it Asthma Alley. So again, through no fault of Lisa or her mom, she was living in an area that her mother could afford that happened to be where the air quality was horrendous. So when we ask what gets in the way of health equity, what would your response be? What have you seen in your career that gets in the way of a person achieving their highest level of health? Asthma should not be a death sentence, not in this day and age. And yet for some, it is, and it has been. So what gets in the way of health equity? And some people will say the social determinants of health. Definitely. Anyone else? What else gets in the way? Politics. Thank you. Yes, definitely. Politics in the current climate could get in the way of health equity. So being mindful of this webinar and our title. So when we think about the future of healthcare education, we need to bring in the politics of our current climate. That cannot be ignored. Someone said racism in medical practice. Again, that cannot be ignored. But I will have colleagues who will push back and say, well, Kenya, I wasn't taught how to facilitate conversations around racism. And it is something that makes me pause because I'm hesitant to talk about racism. And someone said silos is another way to prevent health equity. So knowing what undermines health equity, knowing why it matters and what it is, are really fundamental to moving forward. Next slide, please. So when we think about advancing health equity, look at this image and tell me what you see. Claire, are they able to come off of mute to verbalize what they see?
They aren't, because they're the way the webinars are set up in Zoom, they're attendees, not panelists. So it would just be commenting in the chat box.
Okay. So that might take a little longer, but tell me what you see in this image. What do you see? Now, this is a picture with a red arrow with cracks on the base underneath the arrow. So someone said they see barriers to health equity. And definitely when we look at this image, we see bias and social determinants of health as two barriers to health equity. We have an arrow that points away from healthcare disparities and moves towards health equity. So typically when we look at this image, we think, as someone just pointed out, I see trends. As bias goes up, inclusion and diversity go down. That is, I've used this image for many years. No one has ever said that, and that is so profound. As bias goes up, inclusion and diversity go down. Great call out, great call out. Someone also said social determinants are unaddressed and it enables bias to become stronger. Someone said, we know the direction, but navigating the pathway is difficult. High five. Well said. So where do we go from here? How do we move from healthcare disparities to health equity? How do we reconcile these barriers that are actually creating a gulf between our ability to shift away from disparities and move towards equity? So someone said barriers, but I so see the bright side with the diversity being the roadmap to help move the needle. Thank you for sharing that comment. Yeah. So I can see that too. And it's amazing how we all bring, because of our different experiences, we all bring different perspectives about this image. And no one's perspective is wrong. It's just, you're all sharing a different level of insight. But my question is, what do we do with this divide? Do we focus on the issues that are readily apparent? Or do we try to figure out what could be in those cracks? What's in that gulf that could be creating an even greater divide moving forward? Or do we just focus on what we can see? And that's a rhetorical question. But I want us to be mindful of the fact that, yes, we might be, emphasizing, someone said, and both.
Exactly what I was thinking.
Yes. So it's not going to be this or that. It needs to be this and that. And again, someone said being proactive, not reactive. So how are we proactive? Because some of these constructs could really create emotional responses. They definitely could serve as triggers, and triggers that bring you back to a place that you experience something that's on here. And to one participant's point, right? How are we being proactive? When we think about healthcare disparities, the country has been grappling with disparities forever. And now we have changed the language and we're focusing on being more positive. How can we ensure that everyone, achieves a higher level of health to the extent possible? And what gets in the way? And how do we mitigate some of those issues? Next slide, please. So it might sound daunting. Oh my goodness, there's so much that we can do, so much that needs to be done. But I love the fact that the late, great Dr. Fitzhugh-Mullen, the father of social mission in my lifetime, he shared with us that social mission is the contribution of the school in its mission, programs, and performance, everything that you do, the performance of your graduate faculty and leadership. So what everyone is doing to enhance health equity and address health disparities of the community in which it exists. So his quote, his definition of social mission, could social mission be the panacea that's needed? Or is it just a force that can serve as the momentum that's needed to help us move closer to health equity? And someone said also teaching, learning in a safe environment. So we know what social mission is. We know that as schools for the health professions, our schools should have a mission and a program that delivers to the students that come in, delivers a program that helps them to understand what health equity is, to reconcile some of the barriers, and then to empower them to, when they graduate, to be able to change communities, improve communities. And then we should, as institutions, have metrics to determine the extent to which we have done just that. Next slide, please. So if you have a framework, if you have the definition of social mission, that helps. And again, Dr. Fitzhugh-Mullen said, I understand that this concept could seem so nebulous. Even with the definition, people could struggle with, well, where do I begin? So he didn't just leave us with a definition. Dr. Mullen left us with a framework. And he said we should look at 6 domains. Today, we're going to focus on 3 of the 6 domains. When we think about community engagement, we say, to what extent are the interactions meeting community needs and reducing disparities? We think about diversity and inclusion. What are the metrics used to determine success? We look at governance, faculty governance, student governance. We look at our research. In what ways does our research inform us? And we look at our curriculum. How does the curriculum strengthen the learner's understanding of healthcare disparities and health equity? And how are resources being used to advance social justice? So Dr. Bryant is going to focus on our 3, but before she does, I want to leave you with one thing. Next slide, please. When we think about the institutional culture, ask yourself the question, to what extent are faculty educated in implicit bias, social determinants of health, discrimination, and racism? When you think about D&I, how are admission policies assessed to determine the extent to which systemic issues undermine diversity? And with the educational program, in what ways does your curriculum prepare students to recognize and dismantle structural racism? Thank you. Kelly?
So I want us to think about the statement on here, the scenario. So during a faculty meeting, a colleague reports on the program's attrition and graduation rates and shares that Black and African American students are less likely to progress to graduation and experience higher failure rates on the licensing exam, say NCLEX in a situation. And we hear this. Black students perform poorly on this. We're looking at our statistics. They don't pass NCLEX at the same rate. We don't have the same amount of African American students graduating. So you hear this from a colleague, and they begin to share the colleague begins to share the strategies that the school should use to address these concerns. How would you respond if you were in a meeting and you hear this statement as a fellow faculty member? I'd like you to put in the chat, how would you respond to these statements? What are some of the thoughts that come to mind when you hear this? Anyone in the chat? Refrain from a non-deficient model. Very important, Sarah. Anyone else? How would you respond when someone is reporting these statistics based on someone's ethnicity or someone's race? And take it a step further. When you hear these type of statements, what's wrong with this encounter, these statements? And what are the assumptions when you hear someone report these statistics? What are the assumptions if you hear we have Black students who are not graduating? We have a higher attrition rate among Black students, or Black students are not passing the NCLEX. What goes through your mind when you hear those statements? We have need to get info from people affected first, right? Not jumping to a conclusion. Because when people hear that, we don't know the other elements impacting. Excellent. There are other factors. It's not based on the skin color. It's not based on the amount of melanin in my skin and for the results. We need to dig a little bit deeper. What are those other social factors, those social situations that can be influencing the fact that we have certain communities that aren't doing as well? Do they have access to the same resources? So good. And the key to this question is not just looking at the surface and assuming because the person is of this race, ethnicity, that is the reason that we have that statistics, and digging a little bit deeper to figure out what is the true cause? What are the factors related? So this is a framework that is called the 6 R's. And it's used particularly when you hear comments such as the one in the prior slide. And the first thing we want to do is recognize the opportunity to address racism and consider the extent to which race-related bias is operating. So looking at that statement and saying how much of this is coming from a mind frame of bias. Because when you make those statements, there's assumptions that Black students can't perform as well. They're not able to perform as well. And then what you want to do is restate what was said and ask for clarification as needed. So it's okay to call out some of these comments when they occur. And you want to first paraphrase and make sure you heard it correctly. So I always like to give the person the benefit of doubt and make sure I heard them first. So I believe I heard you say, is that correct? Because this gives the person opportunity. Maybe they didn't mean what they said, or they want to rephrase it. So always start from a non-judgmental, obviously, to ask them, did I hear you correctly? And paraphrase it. You also want to remove the stigmatized issue away from the individual. Many people, institutions may feel that students of color don't perform as well. Or what do you think contributes to that? So instead of turning it into blaming that person and putting the person on the hot seat, which can make them very offended or offensive, pulling back a little bit and kind of generalizing it. So many people, institutions, and getting them to think a little bit deeper. It's not about, again, the skin color. What are the other factors that you think are attributing to this? And then reflect on what is happening and potential bias that could be influencing person's thoughts. And recover by illuminating different perspectives, maybe opening the person's mind up to let them know, well, maybe it's because we're using standardized, exams as part of our admission process. And we know that there's bias in those exams. We have individuals that come from communities where every student is not able to just quit their job, stop working, and focus on school. And we've said that many a times. You can't work while you're in school. That's not possible for everyone. They may need to work to put food on that table. And by working all these hours, they may not have the time to study. They might not have the same amount of time to really focus on their education because they have to work to support their family and their living situation. So are we thinking about those issues? And how do we look at that as an issue and address that? How do we help someone so they don't have to work all those hours to stay in school and also be able to support their family? So we need to rebuild by creating learning environments that avoid stereotypes and control for bias. That is the ultimate goal. So let's go back to that earlier image that we started with everyone's taking this exam. So let's dive a little bit deeper and reflect. In what ways does your school support diversity regarding admission? So again, I want us to use the chat feature. And please, what is your school doing to support diversity regarding admissions? General comments, it is unfortunate some faculty do not have difficulty making statements based on race. And when we ask for additional explanation, they become defensive. Very good point. Absolutely. And that's why we want to try, we still need to address it. We can't shy away from it because we don't want the confrontation, but we want to do it in a way that creates a brave environment for them to explain their statements. But yes, I've had the same situation. They become very defensive, hysterical, getting upset, feel like they're being victimized. These are all things that, yes, can take place when you're addressing these difficult discussions. But going back, and if you're not sure what your school is doing, maybe we can also talk about what are some things, if they're not being implemented now, that can be implemented to support diversity when it comes to admission process. Any ideas of steps that we can take to increase diversity in our student body? And I wish I could see you or hear from you. All right, recruiting in various areas. Yes, if you want a diverse student body, are you going into diverse neighborhoods to recruit? One of the things you can do, think about pipeline programs. Think about going to your high schools in certain areas that have diverse students and talking about nursing, exposing them to nursing, having them come and visit your campus. I do a lot of that here. Including communities of color, international communities in the US, and including them on the admission process. Are they sitting on those committees that are making decisions about who's going to be selected as a student for that university? That committee needs to also be diverse because we see things from different lenses. We want to make sure that there's representation. If we want a diverse student body, we need to have diverse faculty, staff that are making these decisions. Gather alumni, yes, another good point. Give diverse examples of what health providers are represented. Yes, great comments. University recruitment interviews, including community members to interview. Absolutely, another great suggestion. And making sure if you have questionnaires or rubrics that you're using to evaluate applicants, you need to take a look at those tools making sure that we don't have bias in those tools that we're using. I know a lot of schools now are getting away from even using standardized exam scores as part of admission process. And also think about having students serve on some of these committees. Holistic admissions are proven to be more inclusive. Yes, great statement. And also we know, what are those barriers? So in order for us to increase our diversity, we also need to know, what are the barriers that are preventing these applicants from even applying? A lot of times when it comes to education, money is a big factor. So what are we doing to make sure that these students are being able to attend, they're going to be able to finish, and they're going to be able to afford this education and not having to work 40 hours and trying to complete their education at the same time? Do we have great financial packages? Do we have programs that will assist with giving stipends while someone's in school so they don't have to worry about putting food on their table? Great, great responses. And then let's talk a little bit more about, we have these great students. They're here, they're with us. What are we doing to make sure as educators that we are making sure that when they graduate, they have all those competencies that they need when it comes to promoting the social mission that you heard Dr. Beard talking about? How do we make sure that they're going to be, again, those health equity advocates, social justice advocates that we want to enter this health profession? What are we doing as educators to instill that? So students, they are the agents for the social mission. They're going to go out there and be that next generation that's going to be taking care of us and creating a better healthcare environment that's going to provide more equitable care. So we need to play a role in that. In some of the ways, I'm a simulation person, so obviously simulation is a great, great modality for addressing some of these issues. You can have scenarios, for example, where students are not only focused on taking care, again, of the medical component, but are they assessing the social needs of patients and addressing those? We have scenarios where they're being discharged. You're giving them a bunch of prescriptions, but guess what? They can't afford those prescriptions. Do our nursing students know how to navigate that? You want someone to have a healthy diet, but they don't have healthy food in their neighborhood. How are you going to address that? These are the harder issues. It's easy just to give someone a pill and their medications for their disease, but what are we doing about all those other social determinants of health and addressing those needs? I think we need to do more about addressing those as a healthcare provider, and not just, a lot of times our students refer them to social work. No, as nurses, we need to also know, how do we deal with these other factors that affect someone's health? So whether that's through simulation, do we have these case studies and activities built into our lectures? And also in the clinical sites that we choose. We shouldn't have all of our clinical sites in these nice private hospitals. Do we have students going into communities where they're going to see these social determinants and how it affects their health firsthand? Are they in neighborhoods where there's food deserts? Are they in neighborhoods where they have lack of access to quality healthcare? Putting them in those environments so they see it firsthand and they're able to kind of assess and work through those social issues and find solutions. That'll better prepare them for taking care of this diverse population. And then we also need to have these discussions about race. As uncomfortable as it is, I just did a webinar about debriefing these difficult conversations about racism. It is hard. We don't feel we have the knowledge or skills. We don't feel we have the time. We're uncomfortable because, it's an uncomfortable topic to discuss, but we need to have these conversations. And how do we do that in a space that's brave, that people will be open, and that we can challenge each other when people say things that are triggering? So we have some comments. Let me take a pause. Often teaching centers are in impoverished neighborhoods, but no community clients can access the center for services or teaching. And safe. Gail, if you don't mind expanding on what you mean by and safe. But yes, we need to get some of these contracts, these clinical sites, in some non-traditional clinical settings. Great. So as we come to a close, and again, in an hour, we can't address everything and provide a whole game plan for addressing this. But I'm hoping in within this past 45 minutes, an hour, that you're able to take something away, some tidbit. So I want to leave on this quote. A genuine leader is not a searcher, but molder of consensus. So what I'm going to ask from all of you that have participated today, if you can just put in the chat, what is your takeaway from today's webinar? Was it an aha moment? If so, put that in the chat. A pleasant surprise, something you learned, something that you're still struggling with to understand. Or is it something you don't agree with? That's fine. Something you thought was particularly interesting that was said today, something you didn't expect, some kind of new insight, solution, something you want to know more about, or questions that you have. So we have great hands-on prompts, a way of addressing resistance. Excellent. Anything else that you've taken away from today's session? Anything you're going to go back and incorporate into your practice, whether that's teaching, whether that's providing healthcare. All right, if there's nothing else, the 6 R's, great. We'll go into teaching and facilitating. Let me tell you, you can use those 6 R's in everyday life conversations. It doesn't even have to be about racism. Anytime somebody says something that might be, that you may be triggering, those R's come in handy. Great. Yes, I will use the 6 R's. And there's different versions of that. You'll see there's an action framework, there's a open the front door. So if you wanted to have different variations on how to address either microaggressions or statements, there are different frameworks, but they basically all kind of have the same premise. Excellent. So Claire, if there are no other questions, or if, I don't know.
Yes, if anyone else has any questions I want to ask now, otherwise, would you be able to advance to the next slide that I had the evaluation that last
It
slide?
was in the beginning.
Oh, was it in the beginning?
Yeah, that's what Kenya was saying. Yep. Let me, let's see. Oh, thank you for, yeah, that was in the beginning. Let me share it again. Is that it?
Yes, perfect. Thank you. So here's a quick evaluation if you don't, or about the webinar today, if you don't mind taking that. If you don't already, follow us on Twitter at NU_NCEAS. We have our next webinar scheduled for September 14th, addressing firearm violence and medical education. And we'll be having the webinar posted, the recording posted on our website by the end of the week. If you have any questions, please feel free to reach out. And thank you so much.
Thank you for joining us. Is there any way, Claire, to put that link into the chat box and make it easier for people to fill it out?
Yes, great idea. Let me grab it really quick. Give me one second.
And thank everybody for participating, even though we couldn't see you. Thank you. Thank you for attending today's session. And also I will try to find the link to her article and put that in while Claire's putting the link to the evaluation.
Here you go. Sorry it took so long. There is the link to the evaluation.
And I will look for the link to the article.
Let me try again. Here is the link tab for the eval. Sorry, I just sent it to the hosts. Perfect, thank you. And then I also wanted to share the link to the next webinar if you're interested.
And I just shared with you the link to the article, and it looks like you can directly download it as a PDF, which is great.
Perfect. Thank you so much.
All right. It's been a pleasure. Have a great week, everyone.
You too. Thank you, everyone.